First off, can you tell us a little bit about your practice here?
Sure. We are a multi-specialty practice. I practice hematology and oncology and some general medicine. We also have a psychiatric nurse practitioner here. We've got another nurse practitioner that sees some urgent care patients, acute visits, and who's going to be starting a naturopathic clinic soon. We also have an ENT surgeon and an occupational medicine group.
How have you been using VITLAccess? What information have you been able to find for your patients in VITLAccess?
Our staff has really benefited a lot from VITL, and they utilize it the way that I believe it was initially envisioned to be used. They can search the entire state records, and they can come up with the one piece of information that's going to be important to that one patient's case at that one moment. And very often, particularly in oncology, there's one piece of information really germane to your next move. And if you can't get that piece of information, it holds everything up until you can.
Can you recall a specific instance where you've been able to use VITLAccess? And without disclosing the patient's private information, can you tell me a little bit about the scenario and how VITLAccess was instrumental in understanding that particular situation?
We've had a lot of cases like that since we got onto VITL. We've got lots of excellent examples of VITL benefiting our patients directly. I can give you a very recent one because it's fresh in my memory.
Sure.
We had a patient come in who'd recently had cancer diagnosed on a colonoscopy, on a simple screening colonoscopy. And the colonoscopy report read rectal mass at 3 centimeters past the anal verge. And this type of tumor is treated in a very specific way. We were not given the path report when the patient initially presented, and we had to get the path report through VITL. And in fact, it was not a rectal cancer, it was an anal cancer, and those are treated with very different agents, very different side effects, very different approach.
And the implications had you gone down the wrong path?
The best case scenario is that I give the patient the wrong information. The patient has the wrong expectations going forward. Possibly I consent the patient to the wrong chemotherapy.
And finally, if you were to be asked by one of your peers around the state about VITL and VITLAccess, what would you say to them?
It's definitely beneficial. It's definitely streamlined our office activities, and it's definitely improved the care for our patients.